Alrighty, gang, it's 4:30 on the drive home for a Tuesday. I keep wanting to say Monday.
I know. I'm thinking Monday.
Yeah.
But hey, it's Tuesday, and then before you know it, it's going to be Friday.
I know, and that's what's good, what you were talking about, family video opening up. That's just in a couple days.
That's right, yeah. And the other thing that's glorious about Tuesday, of course, you got Taco Tuesday.
Yes.
Who doesn't love Taco Tuesday? And also that we get to have an awesome guest on Tuesday.
That's right.
Not Taco Tuesday related, in the form of Dr. Ryan Jennings, the Chief Medical Officer at St. Anthony's Hospital. Sir, how are you?
Hey, I'm well. Happy Mon Tuesday.
Oh, how are things at the hospital, sir?
Oh, we're good. You know, it's an exciting week because we continue to grow our services and start, again, trying to get things back to what seems to be a reality, hopefully for us moving forward, but doing that in a way that keeps everybody safe and lets folks get back to normal life. And we're going to know a lot more in about 10 days.
Absolutely. I've seen that a lot here. 10 days, 2 weeks, things, where we are. Yeah. So I'm careful to parse my words here, Doc, because I want to make sure that I say this as well as I can. Today, another, not new normal. I hate to say that to begin with, and I hate to say the word only, but 39 additional deaths today reported statewide. That's the low it's been for quite a while.
That's correct. And, and certainly we hope that that's just the beginning of the end, I guess, for lack of a better word. But I'm hoping that, we're going to start seeing things kind of taper off. And but I also am extremely cautious around the idea that this weekend I saw lots of folks out. Boy, it was good to see folks out. I'm the first to be glad to see people out. But I also know that that might come at a price. And so we'll see, but I also didn't see a lot of older folks. I didn't see a lot of, what you would expect to be a vulnerable population out. So what I'm hoping is that even though folks are starting to get a new level of normalcy out there, they're still being respectful of those that have circumstances that would make them vulnerable.
And so, Doc, to that end, you play right into my question that I have for you today, and that is pertaining to this weekend. So I went to two different bigger stores this weekend, and I would say that I've been sort of watching this now for a couple of months, and I would say that, when things were really kind of, in its infancy with all this, I saw maybe 75% of people with a face mask on, and then it was down to 50, and then it was down, in my mind, to like 30, and now I think the place I went yesterday was probably 10%. I've been wearing one, and that's my choice, and I do that because I feel like that's probably something I should do. And I get that some people don't want to do it. But over the weekend, I've seen a whole bunch of things shared online on social media with a picture of a face mask box, the same sort of bluish face mask that I've been wearing. And it says that it will not protect you against COVID-19. Apparently that is printed by this particular manufacturer on the box. But a lot of people seem to be completely resistant to wearing face masks. But at the same time, we have to reopen immediately everything. And so I guess my question to you is, are face masks a really good way to keep this from spreading, or is it not going to help at all?
Well, you've heard me talk about this a few times around the idea of trying to figure out how to thread the needle. And this is a good example of that. And although the face mask itself won't protect you from getting COVID, it might protect you from giving someone else COVID if you're one of those asymptomatic carriers. So the box has to say it, I'm sure, just like the cup of coffee at McDonald's has to say it's hot.
Yeah.
True.
True.
No kidding.
Legal.
So, so there is some reality just into that, but also some reality around the idea that we still need to be thoughtful that although I am, as far as I know, fit as a fiddle, well, kind of round, but fit as a fiddle, and able to go out and be out in society and not worry about myself, if I happen to be a carrier, which I certainly could be. I work in healthcare. I don't want to be the person that's responsible for exposing another individual to that might be vulnerable. So right now, I think the face mask is still the right thing to do. In the next few weeks, actually, we're going to, because of what you saw, we're going to sort a little bit of this out because, enough folks were out and we'll see. And if it picks up in a big, big way, then we're going to all go, oh man, better slow down. Or if it stays relatively flat, we're going to go, all right, good call. And both of those are good answers. I mean, unfortunately, it's an unknown, and we just have to take measured steps. And so, giving that good guidance in advance to say, protect yourself, wear a mask, be safe, and protect others is still good advice. But we'll see how it shakes out, and let's just hope it shakes out for the better. And unfortunately, nobody has a crystal ball.
Absolutely, good answer. All right.
Doctor, you mentioned something about at the top of this conversation about bringing more services back to the hospital. Any more updates on how things are going with that, and any idea on any future services that may be quote unquote reopened back up with St. Anthony Memorial Hospital?
Well, not even specifically to us, but just in general, I think you're seeing hospitals bringing back elective. The elective surgeries, of course, you're aware of, but now starting to do things like elective diagnostic testing, mammograms, CAT scans for lung cancer, those types of things that have kind of been put on the back burner for a minute. And so we're excited to start doing that. We're starting to see more people in the clinics. Not just within the hospital, but within the doctor's office privately that are seeing more patients. So excited to see that. I mean, I guess that's good and bad, but at the same time, I'll tell you, we haven't seen that big of an uptick in our actual utilization of our emergency room, and that tells me that people are being thoughtful and going to their primary care doctor and seeking out care at that level rather than just going to the ER for whatever. And that's good and bad. But as I've maybe mentioned on this broadcast before, you want to be careful with that, because certainly if you have a serious medical condition like chest pain, like symptoms of stroke, those types of things, the hospital is extremely safe, and it's the right place to go when you have those types of symptoms and concerns. And I do worry personally that from time to time folks have delayed care for dangerous symptoms because of concerns about COVID. And so, we are ready. We are safe. It's ready to go. So, but, and it's good to not go to the ER. It's good to not overutilize it on one hand, but on the other hand, it's the right place to be when you have a critical situation.
All right.
Well, I know Brian and I talked about this a little bit earlier about the contact tracing stuff, which now our phones have it to where it, if you do an update on your phone, it will access where your Face ID, could recognize your face for wearing a face mask, and also the contact tracing. Can you kind of elaborate a little bit more on the contact tracing aspect of that?
Sure. I think it's an interesting use of technology to protect our population in a way that we've never thought about before. How valuable it is, I guess, becomes the question. And, when something becomes prevalent enough, meaning enough people have it out there anyway, then it loses its value. We talked about this before about going, all right, if I'm the only guy that has tuberculosis in the whole town, then you track it down and you make sure who I've been in contact with, et cetera. But when you get into a disease situation like this, where so many people have it, it loses its value because you've been everywhere. I mean, you've been to Walmart, you've been to, all over the place. And so it just becomes a useless piece of information out there. So I don't think it's valuable, truthfully. I mean, it is what it is. But in the grand scheme of things, if you are a person with COVID or you've been exposed to COVID, then you need to be talking to those folks anyway and saying, hey, I got this junk, and letting them know and having a decent conversation, around that, not counting on cell phone technology to save us, so.
Right.
So I just don't think, I think it's interesting, but I don't think it's anything that is worth messing with, truthfully. It's kind of funny.
I thought
little...
so too, but I basically turned off my automatic update where I didn't have my phone update because, I mean, it's like there are so many people out there that are asymptomatic that they don't even have a clue if they even have it.
But the biggest thing with this, Tanya, is a lot of people are sharing online. A lot of people are paranoid about it. And Doc, I don't know if you've seen this or not, but a lot of people are freaking out about this thing with Google and Apple doing this because instead of doing research, they're just sharing Facebook and Twitter stuff. People are thinking that this is going to take your contacts out of your phone, take your personal information and transmit it to Apple and Google, and that's not what it's doing. I mean, it is a novelty toy like Doc talked, and it's interesting, but it's not taking personal information.
No, I have to presume not. Obviously, I don't have the proprietary rights to it, but I sure wish I did.
No kidding.
But no, I mean, at some level, I think the folks are trying to figure out how to do this in good faith and try to figure out ways to keep our population safe. But the right answer is be honest with each other. Be careful with each other. Be careful with people that are vulnerable, and don't unnecessarily take risk or expose others to risk that doesn't need to happen. And that's always going to be the right answer. Technology's fun, but the right answer is don't take unnecessary risk.
All right.
Yeah, very good. And maybe that ties in with my what I'm going to say is my final question, which is basically, we were talking earlier about, is this going to be the new normal? Is this thing is going to be around for a while? Who knows at what levels or stage, but it's something we're all going to have to be aware of moving forward. I mean, with, on the political side, you have restrictions and things opening up, and there's a lot to discuss on that. But just in terms of, the many things you've told us, Dr. Jennings, how would you say to just in general to proceed? We've got a long-term outlook you can look at and things we may have to be aware of that years ago we didn't have to be concerned of. But what would you say, just going forward? What would you want to tell people, maybe clear up some of the big misconceptions you've heard out there? What would you say to the listeners, just in general about moving forward in the COVID world?
Yeah, that's a great question. And my grandmother summed it up, I don't know, in 1920. Wash your hands.
Yes.
Wash your hands. I mean, if there's anything that we've learned out of this entire thing, it's about how important it is to wash your hands. Mm-hmm. Now, we've learned a little bit as far as technology and things like that within the hospital itself and healthcare itself. But as far as just people out there in society every single day, wash your hands. I mean, it's kind of cool.
Yep.
To think that so much bread and butter was made over that, but no, it really is true, and I think that you're going to see changes, and we're going to see changes as far as plastic shielding and those types of things, and how people maintain personal space. But at the end of the day, the grand scheme is to keep your hands clean, don't touch your face, and when you do, make sure you do it with clean hands. So I think that if there's anything to be learned, it is that.
Doc, cats everywhere are frustrated with that last statement.
And hey, don't forget your thumbs. that's what distinguishes us from everybody
Oh.
else's thumb.
I'm sitting here looking at my hand like, what's he talking about?
Don't forget your thumb.
Don't forget your thumbs. When you actually study how people wash their hands, the number one thing they forget to do is wash their thumbs.
Really?
They rub lather around their hands
Right.
and they wash their hands off, and they never notice that they don't touch their thumbs, and it just kind of is what it is. It just kind of sticks off at the side. But boy, without it, it's hard to pick up a pencil. So I'd stick to that, and then beyond that, honestly, I think this might be our last party, at least for a while, unless I need to get back on. I sure want to appreciate WXEF for letting me on all these weeks, and I am absolutely available anytime.
Well, Doc, every single time you come on here, we learn something new, whether it be something majorly important or something humorous but important, like washing your thumbs. And so I had never thought about that.
Who would have thought that 10 weeks later,
Wow.
the biggest piece of advice would be to wash your hands?
Yeah, wash your hands and
That's
make
right.
sure you wash your thumbs.
That's right. Well, Doc, as always, the door is wide open for you. We are so blessed to have you in our community, Chief Medical Officer at the hospital, and just a wonderful doctor. And thank you so much for coming on and being with us.
Yes, thank you.
My pleasure. You guys stay safe.
All right,
You too.
thank you there. That's Dr. Ryan Jennings, Chief Medical Officer at HSHS St. Anthony's Memorial Hospital, and so glad to have him on the show again, as always.
Good words, good advice. Words, good advice. Words, good advice.